My name is Graeme with Results Physiotherapy in our Knoxville area at our Farragut location. The following video outlines the manual therapy approach to the treatment of a lateral ankle sprain.
Lateral ankle sprains often occur after some sporting activity, but when they do, they present commonly with a lot of swelling and oftentimes a lot of bruising as well. This is thought to be because of a lot of initial soft tissue injury around the muscles and ligaments in the ankle, but it's also thought now more recently that the joint right by the ankle, called the distal tib fib joint, is also somewhat involved. It's very common that this type of injury results in a significant loss of the ability to walk normally, and also usually quite painful movements, particularly in this direction called inversion. A typical manual therapy approach not only addresses the normal soft tissue problems of swelling, but also begins a mobilization program at the distal tib fib joint. It pushes this joint posteriorly and superiorly, that's backwards and towards the head, and holds it in this position to take the pressure off the rest of the soft tissue. Once this mobilization is placed, then normal range of movement can be once again performed and is in a much more pain-free position, and allows the swelling to begin to reduce and also a lot of the pain to begin to reduce in this area. It's also very common that once this technique is performed, then an additional way to allow continued improvement is that of using tape. 2 strips of tape are applied. The first one as shown here, right over that fibula head, and the same mobilization then is applied. Once this does, it holds that part of the joint in a much better or normal alignment, and then with the fixation of the tape around the ankle, keeps it in place. The first piece of tape, once it's applied, then is supported with a second piece. The second piece of tape going in exactly the same direction, followed with the same hands-on mobilization movement also. By helping reposition this joint into a much more favorable position, patients report significantly less pain almost immediately, and this translates into some change in function. Here this patient then immediately began walking with a much more normal position of his foot, although still quite cautious at that time. These sorts of problems do clear up quite quickly, and within approximately 3 to 4 visits, this patient was back to walking normally again, without any difficulty and a normal reciprocating gait, and also was able to bear full weight on one foot without any complaints.